Our speakers today will be Board of Health Chair Stephanie Wright and County Councilwoman, Dr. Chris Spitters, Health Officer, followed by Executive Dave Summers, and City of Everett Mayor Cassie Franklin. We're also joined today by Mayor John Nearing of Marysville, Mayor Nicholas Smith of Linwood, Mayor Pro Tem from Monroe Ed Davis, and Jason Bierman, Director of Snohomish County Department of Emergency Management. After the remarks, we'll have time for some questions, and I will moderate that towards the end. With that, I'll turn it over to Board of Health Chair Stephanie Wright.
Thank you. Good morning, everybody, and thank you for joining us this morning. In a few minutes, Dr. Spitters will be sharing new recommendations to help reduce the spread of COVID-19 in our community. I encourage all of us to follow these recommendations. Like anything, preventing the spread of illness works best when we work together. We all need to be taking these steps to stay healthy and to keep others healthy too. I've been washing my hands frequently, and I invite you all to join me. Anyone who is feeling ill, please stay home, please stay away from others, and focus on getting well. So I have confidence in the people of Snohomish County and our ability to take care of one another. This is the time to stay calm and to be kind. Focus on caring for yourself physically and mentally. Eat healthy, drink lots of fluids, and please get your rest. Check in on people who live alone. If you happen to live alone, please make a plan with friends, family, or neighbors so someone is checking in on you. We've been taking this disease very seriously. Things are changing quickly, and I know it can seem uncertain. Please make sure you're turning to reliable sources of information like the Snohomish Health District, the Washington State Department of Health, the CDC, and if you need help, please reach out by phone or online. The Snohomish Health District Board of Health will be convening to consider a resolution that formally authorizes the Health District to use emergency reserves in this response. We stand ready to support the staff and our partners in the coming days and weeks. I encourage you to please join me in supporting these efforts and slow the spread of the disease. Our community is strong and resilient, and I know that we can get through this together. Thank you. And at this time, I'm going to introduce Dr. Chris Spitters.
Thank you, Chair Wright. Good morning. I'm Chris Spitters, the Interim Health Officer with the Snohomish Health District. Today, the Snohomish Health District is announcing new recommendations to help slow the spread of the novel coronavirus disease, or COVID-19, in our community. Yesterday, I declared a public health emergency for Snohomish County on this basis. Proclamations like this make it easier for us to work with our partners and to use the best available strategies to keep our community safe and healthy. We need this flexibility to respond to COVID-19. This situation continues to evolve rapidly. As of this morning, we have the following cases. We have 13 confirmed and presumptive cases, 2 probable cases, 37 possible cases waiting test results, 14 we were concerned about COVID-19, but their test results are now negative, for a total of 66 cases investigated thus far. Given the continued number of cases here in Snohomish County and around the state, it is important that we take action during this key time when prevention strategies can make a large impact in slowing the increase in cases in the short run and ultimately reducing the total number of cases that occur in the long run. We are making these recommendations based on our best understanding of this new disease and doing so with guidance from the Centers for Disease Control and Prevention, the Washington State Department of Health, and our colleagues at other local health jurisdictions. We understand that these steps will require coordination and may cause difficulty for many in our community. We are recommending these steps, but we are not requiring them at this time. I want to reemphasize that these are currently recommendations, but not mandates. We know that COVID-19 spreads among close contacts, and that reducing close contact with others can help reduce the spread of disease. This is a prevention strategy used for many other illnesses, and we call it social distancing. For social distancing to be most effective, it must be combined with other illness prevention steps. That means we need people to continue washing their hands, avoiding touching their eyes or mouth or nose, and they should clean and disinfect frequently touched surfaces in their environment. It is crucial that those who are ill with fever or symptoms like coughing or shortness of breath stay home and stay away from others. Here are the social distancing strategies that I am now recommending. With respect to gatherings, as of today, we are recommending that people avoid non-essential gathering in large groups to the extent possible. We are loosely defining large groups as meetings, events, or spaces with 50 or more people. However, people also need to balance the risk to their individual health and the community against the benefit or need to gather. The larger the group, the higher the risk. The closer the contact between individuals, the higher the risk. The fewer the number, the lower the risk. The further apart, the lower the risk. This is a good time to consider postponing events if possible. For people who are at higher risk from COVID-19, extra precautions should be taken. This includes people who are over 60 years of age, people who are over 60 years of age, and people who have underlying medical conditions like heart disease, lung disease, or diabetes, or who have weakened immune systems, or who are pregnant. Any of those categories are considered at increased risk for serious disease. If you have questions about whether you or your child is at higher risk from COVID-19, ask your healthcare provider. We are encouraging workplaces and businesses to provide options for their employees to work from home, if possible. If they cannot work from home, employees should minimize their interaction with large groups of people. People who are sick with cough and fever should not attend work until 72 hours after the fever has resolved or 7 days after the illness began, whichever is longer. We urge employers to maximize flexibility and sick leave benefits to accommodate these measures. For schools, we continue to be in close communication with our local school districts. I had a call with the superintendents in Snohomish County this morning. We know that closures have a large impact on students, staff, and families and require a lot of coordination and cause disruption. As of today, Snohomish Health District is not requiring school closures. However, we all have a common interest in preventing transmission of COVID-19 and other infections in schools. We will continue to work with the school leaders to determine the best measures, including potential school closures, and to support school officials in making the best decisions for their students and families as time goes on. Our school districts have been great partners in identifying the right steps for the health and safety of our community. Watch for further communication from your local school district as well as from the health district. If our recommendations change and we look at either targeted or widespread school closures or postponement of group activities, we will let you know quickly. About contacting your healthcare provider. People who have questions about specific symptoms or care should contact their healthcare provider by telephone. If you have cold or flu symptoms, especially cough and or fever, it is important that you call ahead before going into a clinic. I want to emphasize that anyone who is ill should stay home and stay away from others. Even if you are feeling well, please avoid visiting hospitals, long-term care facilities, or nursing homes. If it is necessary to visit someone there, check on the facility's rules for visitors before showing up and limit your time there and stay at least 6 feet away from patients at all times. For those who have symptoms like cough or shortness of breath or fever, contacting your regular medical provider by telephone is the best thing to do unless you truly have an urgent need that requires immediate care that would take you to the emergency room or urgent care center. Use the phone. Most cough and cold illnesses can be cared for at home with advice from a healthcare provider over the telephone if needed. Please do not go to emergency rooms or urgent care clinics if your illness is mild and can be managed at home. We need to save that space for people who are moderately to severely ill and need the limited space available in those settings. These facilities need to have the ability to serve those who are in most critical need, and we want you to protect healthcare providers and other patients from catching infections during visits that were not really necessary. About testing. We now have somewhat expanded testing options for coronavirus testing in Washington. People still need to contact their medical provider if they are ill in order to be evaluated for testing, and it is not absolutely necessary for everyone with a cold to be tested for coronavirus. The University of Washington is now offering the same COVID-19 test as has been offered by the State Public Health Laboratory. Healthcare providers can request that testing through the University of Washington Department of Laboratory Medicine. Information on how to do this was sent out to healthcare providers on Tuesday. It was the latest in a series of health alerts we have been sending to our medical community about COVID-19 and will continue to do so for the foreseeable future. Those who are being tested for COVID-19 are to remain isolated at home while results are pending. Others who live with them but who are not ill will only be required to enter quarantine, that is, stay home, if the test results are positive, or if they become ill as well. Tracking data on COVID-19. The number of COVID-19 cases in Snohomish County is expected to change frequently. We are now providing twice daily updates on our website at 11 a.m. and at 4 p.m. It takes our disease investigators time to look into cases, and details on specific cases are not available right away. With the expanded testing options, the health district is no longer coordinating every single COVID-19 test requested on a Snohomish County resident. This means we are no longer able to confirm to employers or schools whether a specific employee or student has been tested. We are notified of all positive results, and that is when our disease investigators begin their work. Close contacts of a positive case are notified by public health to quarantine for 14 days while monitoring for symptoms. If there is a case in someone at school, in a workplace, or in another facility, there may be additional communication from the affected facility to notify students, staff, and families that also attend that setting. The health district is coordinating with local partners to help provide accurate information and guidance. In closing, information continues to change frequently on COVID-19. I know that people are worried about the disease. First, remember that this is a mild or moderate illness for 80% of cases. Though the disease is new, it is caused by a respiratory virus, and we have proven methods to help prevent the spread of these kinds of illness. This is the time to stay calm, stay informed, be prepared, and think of others. Wash your hands with soap and water frequently, especially after having physical contact with others, being in public places or healthcare facilities, before eating, after going to the bathroom, when leaving work or school, and upon returning home. Stay home when you're sick. Stay away from other people who are sick. If someone else at work or at school is sick with a cough or cold, make this known to someone in authority so that that person can be asked to leave and go home. Cover your coughs and sneezes with a tissue, throw it away, and then wash your hands. Clean frequently touched objects and surfaces with a disinfectant. These recommendations I have shared today can help us all slow the spread of the disease and will save lives. Please support these efforts to reduce the impact of COVID-19 in our community. Thank you for your attention and for paying attention to these recommendations and for your own health and taking consideration for the health of others. Now I'd like to turn it over to Executive Summers.
Thank you, Doctor. Very much appreciate all the work you're doing. Just want to spend a couple of minutes talking about what we're doing here at Snohomish County, but first I really want to acknowledge the health district, all our public health officials at the local, state, and federal levels. They're doing amazing work. We are going to take our lead, and our role as a county is going to be to support these officials who have the science and the information to really guide our actions and give us recommended and suggestions for action in the future. So we're going to be very much in a support role. So yesterday I signed a declaration of emergency countywide, and what that allows to do, again, is to coordinate all our partners, make sure that information flow is good between all of us, and that we're getting that information out to the public. And as early as last week, we stood up our joint information center and joint information system to make sure that, again, we were coordinating with each other and getting information out in a timely manner. Again, we're going to be based on science, we're going to be based on facts, and judge our decisions based on those things. We've got some tough challenges and some behaviors to change. I think all of you noticed as we were gathering today how difficult it is not to shake hands with each other. That's probably the smallest hurdle we're going to have to face, but kind of points out how difficult it is to change behaviors. And many of the recommendations that the doctor just went over are those types of daily activities that we're just going to have to change. Our goal is to keep people safe, to slow or reduce the spread of disease, and to really protect vulnerable populations as best we can. And again, the information we have to date is the vulnerable populations are folks with compromised health systems, health conditions, and those over 60 are more and more susceptible to this. So a lot of the actions we'll be taking and recommending are based on protecting those vulnerable populations. Another thing we've done here at the county is implement a number of the recommendations the doctor talked about. We're implementing a telework policy. If somebody comes to work sick, will be sent home. If they are sick, they are directed to stay home. And we've canceled any major gatherings or larger gatherings of non-essential meetings like committees and that sort of thing. So we're taking the recommendations that are coming out of the health district and the state and implementing them here at the county. So I want to really stress that we view our partnerships in supporting all our partners in this effort is our key role here at the county. And again, making sure the public and all of you have the best and most up-to-date information. We, again, will be basing our decisions and making our recommendations based on the best science and information available. So with that, again, the British have a wonderful saying, keep calm, carry on. I think ours should be keep calm and wash your hands. With that, I'll turn it over to Mayor Franklin.
Good morning. I'm truly grateful to be a part of the strong collaborative community of Snohomish County, especially when we're facing a public health challenge like this, and really want to reiterate Executive Summers' remarks and thank our health district and our partners and the county for getting information out quickly and leading the charge and reducing the spread of this. So I just want to take a few minutes to update you on the steps that the city is taking in response to the spread of COVID-19. Yesterday, I joined Executive Summers in the Health District in declaring a civil emergency. Again, this is not to create panic. Rather, we want to assure the community that we have the tools in place and are ready to take the appropriate actions quickly when needed to protect their health and safety. You'll hear, as you've heard from our health officials, the risk to most members of our community still remains low. But for the safety of these more vulnerable demographics, we want to take those extra steps and minimize the potential exposure to this virus. As such, the city of Everett has temporarily closed the senior center until further notice, and I know Mayor Smith has also done so in the city of Linwood. We are canceling large city-sponsored events and gatherings and encouraging the cancellation of some other larger gatherings. Our first responders, both police and fire, are taking extra safety precautions. Everett transit teams are taking additional steps to clean and sanitize our buses, focusing on those high-touch interior surfaces. We also have a telework policy and are encouraging staff who can to work from home. And we have reached out to a number of our local businesses and encouraged them to do the same. Looks like there's a phone that's ringing up here. I'm not sure whose that is. That's okay. Our IT team is actively identifying ways for us to keep things running smoothly and remotely through technology. We're installing sanitizing stations in the lobbies of all of our buildings as well as public meeting spaces. We're connecting local businesses with information from the health district to inform their decisions regarding staffing and their events. And we continue to share the leading guidance from health officials with our community, which are those common sense tips such as good hand washing, hygiene, and staying home when you're sick. Truly, it's these everyday things that every one of us can do to help contain the spread of this virus. And we'll continue to work with city teams to determine additional actions we need to take. and I will continue to work closely with our partners across Snohomish County to ensure that we're efficiently and effectively sharing information and resources in our response to COVID-19. I appreciate that these are uncertain times for many in our community and that people are worried or concerned for their families' well-being. I'd like to reassure everyone that we are working hard to stay ahead of the curve and keep on top of this situation. And with your support and participation and taking good extra precautions, we will be extremely successful in that endeavor. So thank you. I guess I turn it back over to Heather.
Thank you, Mayor. Before I open it up for questions, I want to reiterate that the Snohomish Health District's page is the most updated information that's being linked through all of our governmental agencies and partners. The Health District is very appreciative of everybody that's provided support and assistance when asked, and that website is www.snohd.org. You can find a button on our homepage, or you can do /NCOV 2019. And with that, we have time for a few questions.
Of the 37 that you're still waiting test results on, are any of those first responders, and what is the protocol for first responders going out to the calls? Signals?
I will answer part of that and then defer to Dr. Spitters. On the suspected and pending results, we aren't releasing any information on that. Not all of the information is available at the Health District. And I'll turn it to Dr. Spitters for the other part.
So your question is, what is a protocol for EMT safety when they go out, first responders, is to screen the individual for cough, fever, and then if they have cough or fever, then they're donning personal protective equipment appropriate for COVID-19 and then conducting the intervention or the transport.
Can I, excuse me,
Please.
Can I just add that our first responders are wearing, I forget the name of the mask, Chief DeMarco, what is it called? N95s. So anytime there's a respiratory call, a 911 call, our first responders are wearing those masks before they even get to the call to protect their health and well-being and ensure that we have a strong, healthy first responder population to respond.
And on those respiratory calls, would it just be the mask up front until they get there, or would it be the full?
It's not the full gear, it's the mask, it's gloves, it's the protective eyewear. So, and those are highly effective. And then if there's, you know, I would actually have to have my chief answer additional detailed questions on that.
And Dr. Spitters, if I can follow up on the question of social distancing and that recommendation, and just a little more specificity about the sorts of things you're talking about people avoiding. Are we talking about movie theaters, church services, sporting events? Is this event right here a violation of those recommendations?
Well, these are recommendations for individuals. No, yes, this is a group larger than 50. It's not a violation. You know, I would consider this a necessary gathering, but I think it lays out a framework for individuals to assess their risk and decide whether they want to attend movies or go to other gatherings or have a party. And we're just trying to provide guidelines. And the general idea is, in our estimation, that if it's not necessary and can be delayed, deferred, you know, I think you're going to reduce your risk. And then the individual has to think about what the cost to them is of that. We're not at a point where we would say, thou shalt not attend. And it's really up to the individual at this point. We're just trying to make a recommendation and make people aware, have them think about it, weigh the risks and benefits for themselves, and hopefully lean on the side of safety, but it's a personal choice.
You mentioned people avoiding going to nursing homes or long-term care facilities. Anything else you're doing to protect the people who are in those facilities?
The health district is not directly involved in the interior infection control of those settings, but from the healthcare providers I've spoken with at facilities, all that I've spoken with and all ought to be having sort of controlled entry. People coming in having a reason, having signs there about not entering if you're sick, hand sanitizers, masks, and then the level of control over which they sort of enforce, if you will, this recommendation of not having unnecessary visits. That's going to be up to the individual facility at this time. We're not in the place of telling them what to do at this time, but I think it's prudent recommendation.
With the University of Washington testing now, do you expect the number of positive cases to go up? And what does that mean for the health district and the county's response if the number, because of testing, rises?
We do expect the number of cases to go up for two reasons. Right now, limited testing has caused us to need to triage those tests to specific high-risk individuals. So it's possible that that triage mechanism misses people who are at lower risk but nonetheless infected. Also, as this evolves, even with faithful following of these recommendations, we won't be able to immediately terminate transmission in the community. So there will be more cases, more positive results. We'll hear more about them. And as time goes on, then we'll just have to balance our capacity with the demand for investigations of cases and contact investigations and supervision of those contacts. And that's why the cooperation of the whole community, especially those cases and contacts in this, is so important. And I'll just add, I'll repeat something I said earlier. It's not necessary for every person who has a cough or cold or fever to get tested for COVID-19. There are certain people in whom it's a particularly high value. Hospitalized patients who are ill and have an unexplained illness that could be COVID-19. That's important for their personal care as well as for infection control and public health. People who have a compatible illness and who are in an occupation where they are more likely to transmit than in others, again, that's a high priority. Close contacts of known cases, those are higher priority. But as this evolves, there may be more and more people in the community who have a fever and a cough who don't meet any of those criteria but still have COVID-19. And that is the capacity that the addition of the University of Washington Laboratory in particular adds, is to try to open up capacity for that. But I want to urge, if everyone with a runny nose and a cough runs down to get a COVID-19 test, one, it's not going to happen. You're not going to get it. Two, we're going to jam up the urgent cares and emergency care centers, displacing people who really need to be there for urgent care. And three, we'll use up all the tests that are available. And with most of them being negative in people who had other respiratory viruses that are circulating this time of year, influenza, and a long list of others. So,
following your recommendations on staying home, we have to acknowledge that there's a lot of privilege in that statement. So what supports are being in place or being talked about to support families that aren't in a position to stay home? They're working 2 and 3 jobs. In addition, what supports are in place for folks that don't have insurance?
well, the health district has no specific resources assigned to those, to the community at large, available for the community at large in that respect. And we're really relying on employers and other systems in the community network to try to help those people. And I acknowledge that that is a burden, and there are differential impacts on people based on, one, the freedom they have to work from home, and two, their income and their reliance on that income for day-to-day survival. And I can't talk my way out of that with you. That's a reality that we're facing. We just hope that employers and the network of social services in our community can help buffer that inequity in impact.
What did the county say about the Snohomish County victim? Did he visit Life Care Center? And also, a follow-up question to that, has the health district gone to the Life Care Center in Marysville because nurses and employees of that facility have gone to including students?
There's a lot there. Your first question was, I think you're referring to the original case that was reported 6 weeks ago or so, almost 2 months now. That individual did not enter that facility. Your next question is, have you gone
to the Life Care Center in Marysville, considering that there's been nurses, students, and other the Kirkland and Marysville offices?
Not that I'm aware of. We are following up, either we or Life Care or Evergreen are following up on all the Life Care employees that are connected to the Kirkland facility. And if they are a contact from the Kirkland facility, they would be prohibited from entering. They should be quarantined, so they shouldn't be at the Life Center in Marysville. But we can certainly reach out to that center and make sure that those messages are reinforced.
I'm curious about that emergency declaration, going beyond kind of generic talk of better communication, which I think most people would assume already happened. What precise things are you enabled to do now that you couldn't do just 48 hours ago?
Well, for each of us, it's a little bit different, so I'll let the health district. For the county, it allows us to streamline procurement policies and go around them. So for supplies that might be needed by first responders or our own employees or our systems here, we can get around those more quickly. It does give me some authority as county exec to make decisions based on recommendations from the health officer. So those could be any number of actions that would become necessary. We're looking at all kinds of options in terms of, do we need some assistance to, for example, our cold winter shelter, which is still stood up, and so we're working with our partners. But again, it just really allows us to move quicker when needed.
Are there any immediate plans for spending? For spending, for using that flexibility here?
Well, I do know our emergency management team is making a large procurement request for things like masks and other supplies that first responders might need. Our medical examiner is one of those offices that needs medical supplies, which are in short supply now, frankly, because the public has really consumed a lot of them or bought them up. So that's an example. And we coordinate with our first responders. One of the coordination aspects that I talked about, we have started calls, and I know the health district had one with all the school superintendents and school districts this morning to coordinate, find out what their needs are, also give them information. We're doing the same thing with our first responders, and so as those needs become known to us, we can act to make sure we're doing everything we can to get those in place. And we're also working with our state and federal partners too. Have been on the phone with both our senators and our congressional delegation, and they're very aware. So we essentially, I can take actions and just move things a lot quicker without having to go through the usual bureaucracy.
I'll add one additional piece for the health district. It is also allowing us to access any funding that does come our direction, either from the state or the federal levels, in coordination with all of our partners. So that's another piece to the emergency declaration. We have time for 2 more questions.
What sort of measures are being taken to address the homeless population in the county?
Well, we are aware of it. Again, we have a cold weather shelter that was set up in January. That remains open. We're working with our providers to make sure that facility stays open. And beyond that, I'm not aware of any particular actions that have been taken at this point. We're not aware, pardon? Yeah. Oh, I'm going to turn it over to somebody who actually knows what he's talking about in this particular issue. Thanks.
Just this one.
Yeah, just this one, Jason.
Yeah, so we, Jason Bierman, Emergency Management Director. So we have partially activated our Emergency Coordination Center. We have representatives in there from a number of agencies addressing some of the questions that came up earlier. One of the priorities they have right now is to address the vulnerable populations, and we do include within that the homeless population. So we have a team literally meeting right now talking about what are options for them, what are ways we can help folks who are otherwise in need and don't have some of the economic advantages. So that's actually happening literally as we're speaking right now. And we have reached out to our first responder communities, both law and fire, as well as the healthcare system, to get an assessment early on, and we did this days ago, of what their needs may be or will be in terms of the type of equipment that they're needing. And we are, as the executive mentioned, we have a bulk order that we'll be sending today for the whole host of things that we can access through either the state or federal government.
Last question.
So we're giving a lot of recommendations, and as the number of cases
All right, so we have been listening live now to a news conference in Snohomish County where leaders there are giving some recommendations for the community and guidelines concerning the coronavirus. We heard from County Health Officer Chris Spitters. He said 67 cases so far have been investigated, and that includes 13 confirmed cases. Now, officials are recommending that people keep social distances. You heard that term. And that means avoiding large groups of at least 50 or more people. They're also encouraging workplaces to be as flexible as possible now to help people work from home. And then something that they said that maybe we haven't heard before, they said, even if you are feeling well, do not go visit residential care facilities or nursing homes. They say that's really important because you don't know if you could be sick. Also, in the meantime, they said schools are still in session until further notice. But you heard a lot of people talking about exercising good hygiene, which is something that you will hear over and over again. And one thing that they mentioned was do call your medical doctor ahead of time if you are feeling sick. And something that may strike a lot of people, because a lot of people are asking, okay, I would like to take the test. Health officials say, understand it is not necessary for every person with a cough to get tested for COVID-19. So we do know there will be updates twice daily, 11 a.m. and 4 p.m. on the county website. In the meantime, we do have a lot going on this morning in response to the coronavirus. In fact, we are getting an update from state officials right now. We do know that that includes Governor Jay Inslee ahead of his meeting with Vice President Mike Pence. We know that just this morning we are also going to hear from the state insurance commissioner, the director of labor and industries.
Yeah, come on over, you guys.
But here we go. Here's Governor Inslee right now.
All ready? Good morning. It's obviously been a very busy week for all of us in the state in response to our COVID-19 outbreak, and we don't expect that to change in the near future, unfortunately. With me today are Health Department Secretary John Weisman, who will speak, Insurance Commissioner Mike Kreidler, Labor and Industries Director Joel Sachs, and State Health Officer Kathy Lofi will be making some comments and stand for your questions. First, I'd like to say that all of our hearts are with people who are suffering and have suffered in the state. It is significant. The anxiety that family members have about those who are in care or have been affected is profound. We recognize that, and I know all Washingtonians have them in all of our hearts, and we're going to do everything we can for these families. I want to repeat my appreciation for the emergency first responders and the healthcare workers. These ground level people are working day and night. There is obviously some risk to them, and they are showing both professionalism and courage, and I appreciate both. Our priorities in state government in this regard remain the same. We are attempting to do everything humanly possible to slow the spread of this virus, and we are doing all we can to encourage all Washingtonians to be effective leaders in this effort, to exercise a calm and deliberate decision-making in their personal and professional lives. And I unfortunately can say that that is happening. I've been pleased to see that people are acting with a view to science rather than fear, and a view that we are all in this together rather than pure self-interest. And we all be appreciative of Washingtonians' response. I want to thank the legislature for acting quickly in a bipartisan way to approve $125 million in emergency funding that can help a variety of individuals and governments respond to this emergency. The legislation has an emergency clause, which means the Office of Financial Management can begin to take action with these funds just as soon as I sign the bill. These funds are for state, local, and tribal entities to help carry out the directives of my emergency declaration. We're also expecting an infusion of millions of federal funds from Congress. I want to thank all our congressional delegation, Representative Del Benny particularly, our two senators, and everyone who's pitched in this regard. I've had several conversations or texts with Senator Murray, and I can tell you that our delegation has really been pitching in. At my request, the Department of Labor and Industries is working to ensure compensation protections for healthcare workers and first responders who cannot work because they may have been quarantined or may have contracted the viruses themselves. We should have their backs. It's the right thing to do. So our protection will include coverage for medical testing, treatment expenses, and time loss payments for healthcare workers and first responders who cannot work if they are sick or quarantined because of the COVID-19 virus. Labor and Industries is also encouraging employers to continue to pay workers who are quarantined after being exposed. Today, in accordance with my emergency proclamation, our insurance commissioner is issuing an emergency order to Washington State health insurers requiring them to waive copays and deductibles for anyone requiring testing and treatment for COVID-19. The order applies until May 4th, and I'm just great to see our really effective insurance commissioner jump into this task, and he'll speak in a moment. We're also providing operational and workplace guidance to all of our state employees to encourage a healthy workplace. That includes strongly encouraging people to stay home if they feel sick, maximizing abilities to work remotely out of the office, and for areas where employees heavily rely on mass transit, adjusting mass transit options so the number of employees riding simultaneously is reduced. Some of our scheduling can help reduce the load on the public transportation system. We are also encouraging non-essential meetings of over 10 to be postponed or held virtually in any way that is possible. We have good news on the expansion of testing capacity that Secretary Weissman will talk about shortly. We've been involved intensely in this regard. I'm happy we're going to have some good news on that. Yesterday, I met with emergency operations workers at Camp Murray in Tacoma and at the Department of Health in Tumwater. These people are doing tremendous work. I also visited a potential quarantine site on Department of Corrections property at the Maple Lane School, and I left feeling confident that this site can help us meet our needs to help people who have to be in isolation be safe and reasonably comfortable during that period of time. State officials are in touch with local officials in South Thurston County about that operation to answer any concerns there. I'm very confident that that is a safe facility. It is geographically remote, and I feel very confident about that siting. This virus is spread by close contact with infected individuals. Quarantine sites reduce this risk. And I was pleased to hear from the director of the CDC yesterday that he thinks Washington State has the best public health system in the nation. And we've been seeing it at work. The USA Today ran a story this week saying Washington was well prepared for an epidemic relative to our peers in the other 49 states. There are many Washingtonians working at the state and local levels who deserve our thanks for putting us in a position to be able to say that. As you know, Vice President Pence is visiting Washington today. I've already had several conversations with him in the last week, and we will be having more this evening. I am pleased that the federal government has responded to my request and request of several other governors that we have more federal resources to address this outbreak, and it will only improve and expand our response going forward. I'm also pleased that the federal government has waived a rule that otherwise might prohibit testing of people with relatively mild diseases. Dr. Lofi will talk about that a little later this morning. For the uninsured in our state whose doctors believe they need testing, I am announcing that we have the authority and intention to cover those costs by the state of Washington. And we're talking about the costs of the test only. We'll continue to expand healthcare insurance as we are so committed to in the state of Washington. I'm aware that there is uncertainty among the public about whether to get tested for the virus. Testing kits are limited still, so health professionals have established a criteria themselves about who is eligible for testing, and the doctor will talk about that. We need to be clear on this matter. If you think you're experiencing mild symptoms, a positive or negative test result does not change the advice we have for you. Stay home, rest, take care of yourself, avoid contact with others, and follow your physician's or medical provider's advice. Health providers' priority is testing people exhibiting symptoms who are seniors or people with underlying health conditions. Based on input we've heard from numerous medical experts, the vast majority of people who contract the virus will experience only mild symptoms or none at all. So the best advice I can give to people about whether or not to have the test is to talk to your medical professional. They will give you good advice, but in many, many cases, even mild symptoms will not require the test. Now, we know we've had significant outbreaks in King and now Snohomish County. And we know we have to make decisions about how we act to reduce the potential of increased transmission of the disease. And so we believe people need to give serious consideration of congregations of folks that really are not essential to our personal lives and our well-being of our families. So I have encouragement. And my encouragement is that, number one, people with compromised immune system, people with respiratory underlying conditions, people with underlying health disabilities, or are of advanced age, really should not go to areas of congregation and confined settings with other people, given the risk factors that they have at this time. For people who are not in that category, who may not even be concerned about their own health, we think people should give serious consideration about whether they go to non-essential congregations of people that are not necessary for their well-being or their family's health or economic well-being. And the reason for that is that even if you are perfectly healthy, and even if you wouldn't mind having a mild symptoms, you still potentially could transmit the disease because you don't know you may have it. So that's something we want people to consider. Now, this is not an order, but it is encouragement for people to think about our responsibilities to the community. People may think that advice is premature, but with the potential of transmission and what we have seen in other communities such as Wuhan, China, we think it is the appropriate encouragement to people. If we find ourselves in the position of having to cancel events by law, and the governor has the authority under the executive emergency order to do so, we'll make our best decision based on the best medical information we have, on the best genetics information we have, and the best epidemiological information we have. And fortunately, we are very lucky to have some of the best medical researchers in the world today right here in the state of Washington. But we would start this with a dialogue with the community, and that's what we're doing in the last few days. I'm skipping forward a little bit because others will talk about some of these issues. I just will note this too, that this is a period of substantial anxiety in our state. It's real, it's significant, and we need to recognize it. And I just want to say I've been very proud of our state that so far people have kept their wits about them. They have listened to medical expertise. They have largely acted with the community in mind and their families in mind. And I'm just happy that people are going to continue that attitude so we can do the best we can right now. So with that, I'm going to turn it to Insurance Commissioner Mike Kreidler.
Thank you, Governor. Mike Kreidler, Washington State Insurance Commissioner. Because of your enlightened emergency declaration that you made, it's given me the authority to issue today an emergency order to our state health insurers that they are going to cover required testing of COVID-19 without copays and deductibles. In addition to that, individuals will be able to have a one-time refill on their prescriptions as a part of that emergency order so that they don't have to worry about running out while they're being quarantined. In addition, if there's not going to be a requirement for that from the health insurance for prior authorization, that will hinder the ability for you to be able to receive the appropriate testing that is required. And lastly, I would point out that patients that have to see another provider because their in-network providers are would potentially be so overwhelmed, will be able to go out of network and have those covered as if it were an in-network coverage that was being provided. That will be effective until May 4th. That's because the statute gives me the authority to do it. We can do a renewal after that if it's required. But I want to reassure the public that we're here to assist them any way we possibly can and provide clear guidance as to what they have in the way of coverage through their health insurance. Thank you very much, Governor.
Thanks, Mike. John?
Good morning. John Weisman. I work as the Washington State Secretary of Health. This morning I'm going to share with you updates on numbers. We release these numbers at 11 a.m. every day, so I'm going to share today's updated numbers and talk about the testing capacity and where we are with that, and a quick update on the Life Care Center. So today's numbers that we are releasing indicate that our cases now stand at 70 cases. That's up from 39 cases yesterday, so 70 cases. 51 of those are in King County, 18 of those are in Snohomish, and we now have 1 in Grant County. The death numbers remain at 10, and so there are no increased deaths since yesterday. The governor mentioned that we have increased testing capacity on the way, and I want to update you on that. The University of Washington School of Medicine Virology Lab has validated their CDC assay and are now online for testing today. That's welcome news. They will be able to test as much as 750 people. That's 1,500 tests per day. We are receiving additional testing equipment at our state public health lab today and expect to get it operational over the weekend. And when that does, we will be able to test up to at least 200 people per day and hopefully more. We're also really pleased with the conversations that the governor has had, I think the vice president has had with the lab commercial tests. We have confirmation that the 2 largest commercial labs, LabCorp and Quest, are ramping up for COVID-19 testing. Quest will have an initial capacity to test up to 750 people, that is 1,500 tests a day, and will significantly increase capacity in the very near future. We expect that LabCorp will also have high testing capacity, but we haven't received specific numbers on those. I want to touch a bit on the Life Care Center, which, as you know, is a skilled nursing and rehabilitation center in Kirkland where we have had a significant number of cases and a number of deaths. I want to just remind you sort of a bit of the sequence here of events. On Thursday, February 27th, Public Health Seattle and King County was made aware that a number of patients from Life Care were hospitalized with severe pneumonia, and other residents were reportedly ill with respiratory symptoms. Life Care Center had about 108 patients at the time and 179 staff. Test results on February 28th confirmed that 1 resident of Life Care and 1 staff member had COVID-19. Those results were announced that Saturday morning. Understanding the potentially severe nature of this situation and that a large epidemic investigation would need to occur, a request was made to CDC late that Friday night for resources to assist with an epidemiologic investigation, infection control support, and communication, as well as to support response activities associated with other cases and healthcare worker exposures. The request was approved, and on Sunday, March 1st, 18 CDC employees arrived to assist Public Health Seattle-King County. Public Health Seattle King County and CDC have been providing technical assistance to the administration and clinical staff ever since. In addition, Public Health Seattle King County has been assisting them with obtaining staffing resources as needed. The Washington State Department of Health has assisted by providing an infection control expert to assist the team at Life Care and facilitating the acquisition of personal protective equipment and emergency staffing for the facility. Today and tomorrow, a team of clinicians from the U.S. Department of Health and Human Services is arriving in Washington State to assess the situation and begin clinical support as soon as possible. The team flying in today and tomorrow will consist of 28 clinicians, composing of a mix of physicians, nurse practitioners, and registered nurses. In the meantime, we continue to work with Life Center to monitor their clinical needs and assess state resources to provide staffing support. This situation does remain serious, and I certainly send my condolences to the families of those who have residents who have died, and my wishes to any of the ill a speedy recovery. This situation does remind us just how severe an outbreak of COVID-19 can be in our nursing and other healthcare facilities where elderly and medically fragile people are getting care. For this reason, I implore that nobody ill visits persons in healthcare facilities. It is important that we don't take our germs into those places. Washington State is organizing a webinar today for long-term care facilities to help them enhance their infection control and administrative procedures to prevent and respond to COVID-19. Thank you.
Well, good morning, everyone. My name is Dr. Kathy Lofi. I am the State Health Officer at the Washington State Department of Health, and just wanted to say a few additional words about the need for testing for COVID-19 infection. So we know that there are currently a number of people out there in Washington who have maybe a fever or a cough. We're still in the middle of the respiratory season, so there are a number of viral respiratory germs that are kind of circulating around right now. And I certainly understand the need or the desire for people who are currently sick to want to be tested for COVID-19 infection. Just want to reiterate that, from the personal health perspective, you really don't need to be tested. As most of you are aware, we currently do not have medications to treat COVID-19 infection. So whether or not you test positive or negative, the management, your provider's medical management will be the same. And so I just don't want people to be surprised if they call their healthcare provider and the healthcare provider, recommends that you don't need to be tested for this particular disease. I think what's particularly important is that people who are currently sick with a fever and a cough, who are at higher risk of having complications from viral respiratory viruses, and these include people who are older, people with chronic medical conditions, pregnant women. It's really important for those individuals who are currently sick to call their healthcare provider. Almost more importantly, to see if they should be tested for influenza or may need medication for influenza, since influenza is still in our community and we do have antiviral medications to treat influenza. But these individuals at higher risk can also talk with their healthcare provider about, whether they should be tested for COVID-19 as well. So regardless of whether people get tested or not, now is the time where everyone should be thinking that their illness could be COVID-19 and taking additional steps to protect other people in the community and other people in their household from the disease. So in particular, as we've said over and over, people who are sick with a fever or cough need to stay home. And there are also special precautions that people should be taking within their home to prevent the spread to other people in their home. As much as possible, people who are ill at home should be staying away from other people in the household who are ill as much as possible, keeping your distance within your home. Also important for people who are sick in their home to continue to wash their hands frequently and make sure that you disinfect, surfaces in the home that individuals who are sick might be touching. We recently posted some new guidance on our website for people who are currently sick with a fever and or a cough or respiratory symptoms. And just encourage everyone to take a look at that because, as I mentioned, we're in the middle of our respiratory season. We know lots of individuals are sick, and we really want to do everything we can to prevent the spread of all viral respiratory viruses, but particularly COVID-19. Thank you.
Thank you. Before, I just wanted to add something to what John talked about the nursing home. We do have a couple dozen, I think, people are looking at the conditions of the home. We know that there's very large concerns by the family members at that home on a variety of contexts, both communication and whether or not they're receiving adequate care. That group will be in there today and this evening, I believe, and we'll be looking to make the right decisions going forward. It could possibly, I repeat, possibly result in one of the public health agencies having to assume control of the particular organization. That is only a possibility at the moment, but I want you to know we do have significant concerns there, and we know these families are really worried about their loved ones, and we share that view, and we're going to make the right decisions at the right time. With that, stand for questions.
Governor Inslee or Secretary Wiesman, have you heard if any Washington State residents are stuck on the cruise ship off of San Francisco?
John?
We don't have any information on that point, so I don't know whether there are or not.
Secretary, do you have any sense of any more information on the Grant County case and any idea of how it might have gotten there?
I don't at this point. The information just came in to us right before this press conference, but we'll be getting back to you all, and I believe some of that will be posted on the website.
Mr. Secretary, are you sending in new staff to the nursing home in Kirkland to replace the previously ill staff there?
So Public Health Seattle King County has been working with local folks on helping to staff that. And we have had infection control staff up there who are helping to train staff who are coming in to make sure that they're following the appropriate procedures and that they are providing safe care both for the patient and for themselves, along with the CDC team that's there as well.
Could I follow up so long? Why is it taking so long to get test results back from Eastern Washington, Spokane, and Colville? It's taking much longer than it's taking for over here.
John, do you have an answer? I haven't heard that.
What I can tell you is that all the tests that we have had in our lab in the last days since we've been testing, once we receive them, we've been testing them the same day, so and getting results out the same day. So to my knowledge, now again, there's time to ship the test to us, but in our lab, test results are getting out the same day. We may quickly find ourselves backing up, but that's why we're pleased that the University of Washington test site is coming on board as well.
Will there be a quarantine site in Eastern Washington?
We are looking at quarantine options right now in the Emergency Operations Center and considering places all across the state. I don't have those pieces with me right now, but I know that the staff are looking at potential places and facilities across the entire state.
Quarantine sites, there was some concern.
Just for a moment, I wanted to add some. We'll get back to you. We'll look at this if there's been any unreasonable delay. We'll give you some further information. I do want to note this is that we need to accept medical reality here. This disease, this virus, is going to spread across county lines, and we have to. That is a realization, and we're going to do everything humanly possible to slow that, and all of us have some role in that. But as this virus spreads, we just have to recognize that as a reality. It should not cause us to run panicking in the streets. It should cause us to redouble our efforts, in my view, to slow the transmission of this virus. Essex?
Can I follow up with you on large gatherings? You have urged people to reconsider those large gatherings,
right.
But there are still large gatherings going on, sporting events, the comic convention. Since those folks don't seem to be taking your advice, are you ready to order such large events canceled?
Not at this moment, but it is within our authority to do so. And we will make that decision when we decide that the benefits to the state of reducing that social contact merit the dislocation and economic dislocation and personal freedom of people. We have not made that decision to date. One of the things we've learned is that before one makes a legally binding decision like that, it is better to depend on voluntary decisions so people buy into this community decision. We're in the stage at this of this challenge where we're encouraging people to be internally thinking about the right decisions themselves so that they become leaders themselves, not just in a top-down organizational pursuit. So we're encouraging people who have medical conditions to not go to these events. We're encouraging people who do not to seriously consider whether they think it's the right thing to do. And we are asking people who are responsible for the events to seriously consider whether or not it is better for everyone concerned to pause these events. That's the right thing to do at this moment as we're having a community dialogue about this. But there could come a time where we make a decision that makes that legally binding, and that is an authority that's granted to the governor's office. I take that authority seriously, and it won't be taken lightly. If we make that decision, it will be based on a very thorough evaluation of the science and the epidemiology. I've been involved personally in this review for days now, looking at the medical literature from around the world. John and I last night were on a call with one of the lab directors in this regard. And so we're really looking at a deep dive into what we think would be most effective in reducing the transmission rates that has the minimum impact on people's lives. So we're involved in that literally on an hourly basis. But I do want to reiterate, and for those who think delaying or pausing some of this activity is premature or an undue thing to think about, we just need to look at Wuhan and what it eventually meant for their society, where they had to come to full stop. So acting even before we see mass casualties may be the most effective thing to do, and we can all be leaders in that regard. So we're asking people to look ahead a few weeks and not want to be in the position in Wuhan, China. And everyone can be a leader in their family or their company or their city or their county in this regard. And we hope people will seriously think about this. So we're going to continue that dialogue.
The public
Yeah.
putting into, when you look at China, for example, Wuhan saw serious cases, and Beijing, they had a different reaction to the outbreak. And so a lot of people are crediting fast things like premature decisions, like what we're calling today, as making a big difference. So are you guys looking at kind of the science in China and how you kind of make that threshold of when to call mandatory quarantines?
Yes, very much so. The World Health Organization commissioned a study of what was done in China, and I've read the summary of that study. I hope to be talking to the person who actually wrote that summary with John and myself here shortly, as soon as we can get a hold of him. So yes, we are looking at what effectively worked in China and other places as well. Now, the difficulty, why this is a difficult decision, if I can just share my burden with you in the state just for a moment. The science can't inform you that if you do X, you'll get a Y percentage in the rate of transition. There really isn't the science that is that acute. What we know is that when you reduce social interactions within 6 feet, you reduce the risk in any social interaction of the transmission of the disease. That we do know. So things that reduce the number of those interactions do reduce the rate of transition. That we know. But the difficult thing is decide which part of our economy and our society makes sense to put on pause. There's no algorithm to tell us that. So we got to make the best judgment we can, and that's what we're doing. Yeah.
You mentioned reimbursing first responders, healthcare workers. What about tech employees maybe who can't work from home, or the person who cleans that office that is shut down, or a parent whose school is now closed for 2 weeks who has to stay home with the kids? Could we expand that?
So there's probably not under the existing workers' comp system, because the workers' comp system is largely involved, essentially set up to compensate for injuries or sickness that are caused by the employment situation. And that is the cost of that is borne by the the business is responsible for that. So that's probably not the perfect system to use for that purpose. We do have an unemployment compensation system. We are looking at some possibilities in this regard. It may require some decisions by the federal government. We are looking at some of those issues today to figure this out. I know that one of the things that I was just thinking about this morning, I was reading one of our fine newspapers, is that our society is not equitable, and the burdens are not going to be totally equitable that fall on people. It's easy for folks in the tech community, for many, to telecommute. But if you're a nurse or a bus driver or a worker in a manufacturing plant, you can't telecommute. So those folks have a much larger difficulty dealing with this. So what I'm saying is we're going to look for every way to ameliorate that we can, and some of the things we announced today is heading in that direction, including paying for the testing for people who are not insured, and I'm glad we're doing that. I'm doing that on an emergency basis.
Governor, North Shore School District's closing, and they're going to do online teaching, I think, for up to at least 2 weeks. Thousands of parents in other districts are signing petitions to close schools. Where do things stand on that as far as this concern that kids could bring the virus home to vulnerable people?
Number one, we're pleased that school administrators are really seriously looking at this issue. I know that those who have not closed schools are beginning to make plans for how to do remote learning in the event they need to do that. I encourage that, looking forward. At the moment, we are deferring judgment about schools to the school leadership. I'm not the only elected official in the state. We have school boards that are elected school boards, and they control the school system. So at the moment, we are deferring to their decisions about this.
But would that ultimately change?
Could.
Changed for the statewide?
Yes, it could. So the governor does have the authority to make decisions about essentially any type of congregation or gathering of people, and that could be a decision we make. Now, for those who have wondered why I have not made that decision today, it is because we are still evaluating the efficacy of that. We are also weighing this against the needs for childcare that is profoundly a challenge for families already, and what that would mean. I'll just give you an example. If we shut a middle school and Johnny has to go home and their father, who's a nurse, has to go home and can't go to the hospital to provide health care, that these things have ramifications. So what I can tell you is we are continuing to evaluate the efficacy of school closing. We are talking to school administrators about this subject, and we're going to continue to evaluate this on a daily basis.
The quarantine site in Kent, I know that there are some people who are concerned about the fact that it is voluntary so people can walk in and out of that motel. Governor, or if anybody else wanted to answer this question, is there any consideration of making it maybe mandatory quarantine so that people who are sick, who are going to be put in that community, will not be able to freely walk in and out and maybe spread the disease, or the virus, I should say?
I believe the state would have authority to issue mandatory quarantines. My sense is at the moment we've got really good cooperation widely. It may not have been 100%, but I think we potentially have that authority. But John, do you want to address that?
Right, the governor's exactly right. The local health officers have the authority to actually order isolation and quarantine if need be, isolation for those who have symptoms and are ill, and quarantine for those who might have been exposed but aren't exhibiting symptoms. In Washington state, and as the governor said, most people do voluntarily comply, and we have to start with voluntary compliance by state law, which we think is appropriate. Really, it's about encouraging people about why this is important. And these facilities, for example, are particularly important for us, for folks who don't have homes, whether that be someone who's homeless or traveling through for some reason and doesn't have a place to stay. So it's really, the piece of starting with voluntary. And we find that folks are very cooperative, and part of it is having conversations with them about what their needs are to make sure that whatever they might be concerned about, we're taken care of.
What do you say to calm the fears, though, of city Kent leaders out there, and also the police chief out there, and some people who live around that Kent motel, who are saying that they were blindsided with this location? What can you tell them, to calm fears over there?
Yeah, well, I think first of all, it's important to remember how this disease is spread, which really gets back to our main points. This is primarily spread through droplet spread. You have to be within essentially 6 feet of someone for a period of time in order to become infected. And so by isolating people, by putting them in spaces where they are not engaged with other folks, we're actually really helping to prevent everybody from further spread. Just like when we're asking people to quarantine themselves or isolate themselves at home. We're keeping them away from folks. It's the social distancing piece. So it's the right thing to do. The science says that's what the right thing to do is. And, people want to do the right thing, and we trust that. Thank you.
I'll just make one comment on it, too. That obviously, it's important for us to talk to local communities about these concerns. I don't know if that was successful in that circumstance. We were not involved in it. But look, we can't, ship Washingtonians to Mars here. We need to care for them. They're our fellow citizens, and we need to find places to do this. And I will tell you, I was at our potential isolation site in Rochester yesterday. There are RVs, and there's a chain-link fence around the area. I would have no concerns with my family members living just right on the other side of that fence, because I think the transmission has to be so close. So I think we're going to be able to find good sites for people, and after we listen to everybody. Thank you very much. Be safe. One other thing. Yes.
National Guard this weekend has got a drill. Are they on any kind of increased standby? This is something we're just seeing.
We have the Emergency Operations Center up and running, and we have numerous guards, men and women, who are working diligently in there. I was there yesterday. We'll be there again today. I don't think, and I'll try to get back to you on if there's any call-up or anything. I don't think there has been, but we'll get you some further information. One other thing I want to add, we just never miss an opportunity to not remind people of what we can do personally on this. Don't please go to work if you're sick. Please wash your hands. Please recognize the governor's executive order that if you shake hands with people for the next couple weeks, first the governor is going to tell your mother that you violated the hygiene rules, and second, we might put your name on the do not handshake list. So we hope people can use the old elbow bump, and I'm actually serious about this. This can help a lot. Be safe, take care of your elbows.
Yeah. All right, everyone, we've been listening into a news conference now since 10:30 from Governor Jay Inslee and the state's top insurance, labor, and health officials. Big number change now. We now have 70 confirmed cases of coronavirus. That is up from 39 yesterday. 51 reported in King County, 18 in Snohomish County, and 1 in Grant County. So we are adding a new county to this list. The number of deaths has remained the same at 10. Now, Governor Inslee says there is $125 million in emergency funding, and he's expecting more from the federal government as well. Other highlights in that press conference: the state is recommending compensation for health workers. This is for things like medical testing, treatment, and time lost payments for those who cannot work if they are sick or quarantined. There will also be an order to health insurance companies to waive copays and deductibles for testing until early May. And also, uninsured folks will be covered for testing if health officials call for it. There are still a limited amount of tests, and if you have mild symptoms, you will likely not be tested because the doctor's orders will be the same, and they want to use those tests for higher risk patients. So we are expecting to hear from Governor Inslee again, along with Vice President Mike Pence at 5 p.m. today. We will have that live for you right here on King 5. You can also find the latest on the coronavirus outbreak on our website, king5.com. Thank you so much for joining us for our continuing coverage this morning. We will turn you back to regular programming.